To put in new orders, I'm going to go to Current Orders. And here I can see what has already been ordered, such as the Initiate Bowel Care Protocol. And this will lead into a set that we're going to order later for the RN Bowel Protocol. So to add new orders, I'll click on New Orders. And here I'm prompted to enter the provider and the source. Typically, the provider who is assigned to the patient will appear as the first option. If you're not seeing the appropriate provider, you can go to Other Provider, and you can search for that provider. For our purposes, though, I will use Train Hospitalist. And then there are a bunch of different sources that you can select from, depending on where you get the order from. So popular ones are Provider-Initiated Protocol, Standing Order for e-sign, telephone, and verbal. The providers at our facility are highly encouraged to place their own orders, but for our testing purposes, I will show you how to put in orders, and I'll put it in under verbal. So once I've selected these two, I can say OK. And from here, I would want to select New Order because I'm going to add new orders, and I'll search the order I would like to place. So I'm going to search Foley, Insert. And I'll simply check the order here. Next, I'll search for CBC and BMP. And lastly, I'm going to add a CT. To do that, you will want to look for the location first. So I'm going to search abdomen. And I'll see my abdomen CT. Check my order there. Next, I'm going to add some new medications. So I'm going to go to New Meds. I'm going to search Tylenol. And you can select either the Tylenol or the route. If you select the route, it saves you a click on the next page when you're editing your orders. So I'm going to select PO. Lastly, I'm going to add a new set. And I'm going to search bowel. And here I'm going to add the RN bowel protocol. And as we saw in our current orders earlier, there was an initiate bowel protocol. So based off of that order, the nurse can go in and add an RN bowel protocol set if the patient meets the parameters. Before we move on here, I do want to point out that we can see all of the orders that we have queued by going to the queued at the top right. So from here, we will click next to manage our order list. And the first thing that we're going to see is the order set. So we have two options here. We have A and B. So based off of the policy that is in the initiate bowel protocol, you can select protocol A or B if the patient meets those parameters. For our purposes, I'm just going to select protocol A and do Miralax. And so the nurse can put this in as a provider-initiated protocol on that order source. And then the rest of our orders are here at the bottom. So nothing has been ordered yet. You have to check it to order it. So I'm going to check Tylenol, Foley, and you can see here that the red edit button has popped up with a little asterisk next to it. Anytime you see this, you'll need to edit those details. So I'm going to open this, and I can see here that there's an asterisk next to this question. There are no other asterisks besides this one and these, but these are already filled out. So I'm going to drop my arrow and select an option. And then I will select next. And this is telling me that based off of this order, the system is going to order another order, and they call these reflexes. I'll select close. And you can see your reflex order populated down here at the bottom, and it's pre-checked. I'm going to select my CBC as routine, and my BMP as routine, my abdomen routine. Diagnostic imaging is special in that there is an appropriate use criteria. I'm going to click on this red edit button and address any of the asterisks, so reason for exam. And sometimes you'll fill in those asterisk fields, but you're not able to hit the next button to get back. Meditech needs you to click off of the screen to register that something has been typed here. So I'll click here. And our AUC has populated. Of course, this is a test patient though, so we're not going to be actually able to do our appropriate use criteria. I will just minimize this. And I'm going to proceed without an AUC. In a real world situation, I would want to properly address this. So I'm going to select next. Sometimes you'll see a suggested order of diet. I'll scroll down to make sure that I've covered everything. And then from here, I can click my next button. If you've ordered any medications, it's going to ask when you would like to administer the first dose. I think tomorrow is fine, so I will do tomorrow. And I'll select OK. And here I can see a preview of all of the orders that I am about to submit. At the bottom here, I will select the Submit button to submit my orders. Lastly, I'm going to show you how to edit orders. So to edit orders, you can simply click the word ordered under status or the word active. It'll be in the status column. I'll click this word. I'll be prompted to select my provider and source again. And then I can simply stop the order. I will provide a stop reason and select OK. And I'll submit my changes. The other way to stop your orders is to click this Edit Multiple. You'll check the orders that you would like to stop. And then you'll notice that these buttons become available. I'll click the Stop down here. I would select my provider and my source, select OK, provide a stop reason, and select OK. And then submit. Lastly, I wanted to quickly discuss ambulatory orders. So you'll notice that ambulatory orders, the layout looks very similar to orders. The key difference is that orders is for while the patient is here and ambulatory orders is for when the patient goes home. So this is going to be your discharge medications and discharge equipment.